right, we're back. Hi, everyone. I'm here with Inder Singh. We were just talking New York and San Francisco and lifestyles and weather. You said you were in San Francisco for a while?
I'm in New York, but I lived in San Francisco for 4 years, and man, do I miss the weather out there. So,
what were you doing in San Francisco?
It was Web 1.0 startups.
Gotcha.
Yeah.
And now you've migrated to a new type of startup.
That's right, yeah. I'm working in a mobile health company that also has a medical device that's part of the overall vision for the company.
Okay. Well, that's funny because my life has been revolving around medical health and technology a lot lately. I was moderating a panel where MC10 and Basis and
cool.
It was actually really interesting, and I don't know a ton about the space. So what got you into that space in particular?
Sure. So the long story short is that I started my career in entrepreneurship, if you will, in college when I started a nonprofit organization. And I found that healthcare marries up very much with my interest not only in starting companies, but also in having a social impact. And so over time, I've sort of migrated more towards the healthcare product side of things for that reason.
Okay. Well, what is it? You're holding a prop right now.
I am holding. I'm holding our first product. This is the world's first FDA-approved smartphone connected thermometer, and it is. We got the approval in December. Really psyched about it. It's also one of the least expensive electronic thermometers ever made because we use the smartphone. You can see the headphone jack here. So it plugs in via an extension cord or directly, and it takes a temperature, but it does so much more than a normal thermometer does too, and that's because of the software that's associated with the thermometer. So let's say that you're a parent, and
I am a parent. I have a 3.5-year-old daughter. This would be awesome.
You're our target customer.
Tell me more.
Target customer. So let's say your 3.5-year-old daughter fell ill. Instead of going and getting a regular thermometer, you break the Kinsa smart thermometer out. Using the screen, and I don't have a smartphone with me at the moment, but using the screen, we create a fun and engaging experience for mother and for child, potentially making it easier to actually get your child to sit still to take a temperature. But what you really care about when you first confirm that they're ill, they have a fever, is not that they have a fever, it's how to get them better. And so through the software features, we allow you to do all sorts of other things. So for example, let's say your child had a fever, and you say, heck, they must be getting sick from one of their friends, so let me go check the health at my child's school. So now you can go and see the private group that you joined with other parents, and you can see what's going around, whether it's strep versus the common cold. You can even book a doctor's appointment straight through the app. You can track their symptoms with a few simple taps and show that to your doctor when you get there for a better diagnosis. So it sort of becomes a much more, an app that sort of allows you to take care of your family, much more than just a thermometer. And the whole vision behind Kinsa is to create the world's first real-time map of human health in order to track and stop the spread of disease by collecting real-time geolocated data on leading indicators of illness. So.
Okay, that geeks me out. That's the part that I like. I mean, devices and apps and, yes, you would be helping my daughter. You would be helping make my life easier. That's lovely. Also, massive amounts of data that can lead to understanding illness patterns.
Absolutely.
That's great.
And so that's why we created it. We started with the mission, and we thought to ourselves, how can we begin communicating with the ill to give them value, otherwise they're not going to use the product, but in return, collect data to map human health. And the thermometer is the world's most common medical device. It's the very first device anyone uses to confirm illness. And we're now piggybacking off the most widespread medical behavior in the world, a parent taking a child's temperature to understand where and when illness is spreading so that we can actually track it and stop it.
And, okay, my and to add on to that is it only works with smartphones because it has the app, right?
So the value of it'll work with any phone, right? We can make it to work with any phone, but the real beauty and the elegance of it is really through a smartphone interface because the graphics are so much more intense. You can transmit so much more information. So we're hesitant to make it work with feature phones and spend a lot of effort there. But the question then becomes, is smartphones enough? And I actually think it is, right? Because 75% of the United States of phone users are using smartphones today. 90% in Singapore. I mean, smartphones are one of the most rapidly diffusing technologies in history, and we're just going to ride that wave.
Interesting. And yes, that's true. The ubiquity of smartphones is growing. There is also a massive, I don't like saying the word, but there is a massive proliferation of cell phone usage and texting in emerging markets. And it would seem if you need massive amounts of data on health-related, illness, that there would be a lot of opportunity to expand smartphones and beyond around the world.
Yeah, Leah, I'm glad you asked that. I'm glad you said that. So I spent the better part of the last 10 years of my life working in 35 emerging markets. So I used to run very large-scale public health programs in those places. So my heart is definitely in a global impact. But if you go to some of these cities, like you go to Johannesburg, South Africa, you go to Nairobi, Kenya, you go to Delhi, India, you go to Shanghai, these are places where there's already really high smartphone penetrations. Mm-hmm. Yes, we won't get to the rural countryside in Kenya right away, and maybe then we'll start making this a cool user experience with an SMS interface. Mm-hmm. But for now, I think let's get the product out there, start getting it going, and then we'll see what we get from there.
Well, yeah, my brain just went to all sorts of fancy places like partnership with UNICEF. And what are you doing? Like, UNICEF, what are you doing in these places? But where are you in the cycle of just getting it out there?
So got the FDA approval in December, have 1,500 people on a private beta test. We'll be launching online sales on April 1st, and I'm really psyched to say that 2 of the largest retailers in the nation will be carrying us nationally starting in the fall, and that 3 major children's hospitals will actually be providing this to patients for free. So I'm really excited about that. So we're just getting going. We'll start in the U.S., we'll go to Europe, we'll go to Singapore, and then we'll start getting to emerging markets.
Can you say who those retailers are?
I'm not at liberty to say who those retailers are
Gotcha.
Currently, but hopefully in a couple months.
Well, okay. You started this conversation by talking about price point. One of the things that I heard on that panel the other day was by someone from Kaiser Permanente, and he was talking about probably the biggest failing in developing medical wearables right now is people's lack of consideration for price point. At least this was one man's perception, but he's like, basically you're making the stuff so expensive that somebody who's really concerned about spending $199 for a watch is not going to buy that to track their vitals or their health or whatever. So what kind of price point are you looking at?
Yeah, so I agree that if you want widespread access, price matters. It simply matters. And that's why we didn't, I can make this for a unimaginably low cost. It's because there's only 6 resistors in there and a capacitor for you electrical engineers out there. Basically, there's no batteries, there's no LCD, there's no display. We leverage the smartphone for everything. And so this is probably the lowest cost. This is certainly the lowest cost connected medical product ever made. This is lower cost than a thermometer is today. So while we will sell it at a reasonable price point because we want it to be perceived as valuable, we will also find other channels to get it to users for free. So starting sales around $20, maybe a little less than that. But again, we'll find other channels to get it to users for free.
Well, like giving it away through children's hospitals.
Exactly.
That's amazing.
Yeah.
Not just human interest-wise, that makes my bleeding heart bleed even more. But I actually think it's really smart because you're hitting up a broad user base, and you've got them using it. Like,
and the children's hospitals will cover our costs too, so we won't be bleeding money, if you will. So
win-win.
Absolutely.
Okay. So, question from the audience. Okay, what is the biggest technological hurdle facing wearables in medical?
Yeah, I don't, it's interesting. The technical hurdle is much more about regulation. It's much more about trying to figure out how to create a brilliant consumer user experience while meeting all of the disparate health information privacy laws and the medical device regulations. Because remember, those vary by country. And so you have to figure out how to be able to address them all at one time if you want to be global. And even in the United States, it's very complex just to be able to address it. So it's hard for folks who don't have a very strong healthcare policy kind of background to think through those issues. But then again, those folks are not necessarily the designers and the technologists. So marrying the two together is really the challenge, I think, in healthcare.
And I found myself sitting here asking, I'm glad you said that. That's brilliant. But I was like, why did he have to get FDA approval for this? Is it because it goes into your why?
It's interesting. Thermometers are considered in the United States Class 2 medical devices. They're just considered Class 2 medical devices. So, all of those wearables that you hear out there that want to take body temperature cannot be marketed for illness. And there's like this very fine line where the FDA may come in and start regulating them. You may have heard the Samsung Galaxy 5 now has a heart rate monitor. The government of Korea is actually evaluating whether to actually ask Samsung to go through the medical device regulations for it. So that's the challenge, is that from an ethical perspective, you need to make sure this stuff works, and it works based on high standards of medical ethics and the medical approval cycles. And that's a huge challenge. It's not a small challenge. So.
Well, is there any governing body or information resource that you can point people to? Like, you can learn that all on your own, but
Absolutely.
is there who helped you learn that? Where did you go?
So I had the fortune of having had to deal with this for many years. So I actually used to advise FDA. I used to work at the Clinton Foundation and was an executive vice president of their national health program. And so I've dealt with a lot of this. And so, there's a difference between the letter of the law and the policy and sort of figuring out how to navigate it, the tacit knowledge. And we're very fortunate that we have that built into our team, from myself and a few other folks. It's not simple. And that's, I think, one of the big challenges.
Which is to say, medical device and wearables companies, if you need advice, come hit up Inder.
Happy to talk. Happy to talk anytime.
He's your man. Yeah, it's really a particularly complex space. And I would think one that would take the kind of heart and passion that you have for making the world better to want to get into, because it's not like it's too complicated for it just to be an entrepreneurial decision, I would think. But maybe I'm wrong. Tell me about that for you.
I appreciate the kind words there. I mean, others may have different opinions, but my belief is do what you're passionate about, and why do something easy in the world? Do something that's challenging, that's going to really have an impact. And that's me. And I'm very, very excited and really pleased that there's been a whole bunch of experts in technology and design that have just come to help us. And a lot of people have just said, no, I just want to help. I'm not looking for a job. I just want to help. And they volunteered time to help us think through things. It's been amazingly gratifying. And we're excited. We're excited that we have such great supporters.
Well, okay, so you've got a lot of internal knowledge. You've got a lot of great supporters. But where are the best resources? So if you're advising someone who's trying to get into this space, where should they go to learn?
Yeah, I mean, you can go online to fda.gov. You can go online and look at the HIPAA stuff. But what you really want to do is find someone who's been through it before. And when I say find someone who's been through it before, I don't mean a lawyer. I mean somebody who actually has navigated the legal issues. Because if you deal with the lawyers, they're going to give you the letter of the law, and they're going to be very conscious of liability issues. What you really want to do is take a risk-adjusted approach to this and think, well, what's important? Who do I talk to? How do I sequence the right activities? And you just have to find someone who's been through it, and that's not so easy. So I would just say that if you're in technology and you're really interested in health, partner up with somebody who knows that side of the equation.
Okay, so here's my question. What didn't I ask you about what's happening next for the business that I should have asked you?
Oh, interesting. So you, let's see.
I like that question because it's so open-ended that it's like...
Absolutely. So I think you could have asked, well, why not other products? Why not blood pressure gauges? Why not, other sorts of things? And the answer that I would have given to that is that thermometers are unique in the world. First, every household has a thermometer. If you have a kid, you have a thermometer everywhere in the world. Second, this is interesting because it gives us social data. Because if you have a fever, probably contagious in some way, most likely, right? So it gives us social data, whereas a lot of the other current non-connected medical or healthcare products found in the home do not give you social data. And so we're really focusing on thermometry products as an entry point, as a way to begin communicating with the ill, and then focusing on the software experience surrounding that. So this is really simply, while it gives us fever data, it's really an entry point to talk to the ill. And I think that's perhaps the reason why we're focusing on this particular product and not other connected medical products.
So to that point, and thank you, that was a great question that I should have asked you. Are you partnering with people like the NDC? I mean, they're tracking global spread of disease, and why, like National Center for
CDC, absolutely.
Yeah.
Centers for Disease Control, World Health Organization. We want to partner with them. We want to be a resource to them. But I think what's interesting, healthcare is a pseudo-government industry in many ways. It's highly regulated. Hospitals, nonprofits are big buyers. Governments are big buyers. And I'm sort of a believer that consumers adopt technology faster. So go to the consumers, and then once you prove yourself, once you prove that you can get unique data and do unique things, then that's when you approach the government agencies to say, look at what we have, let's partner together. And so we're starting with moms. That's our target customer.
Start with me. I will beta for you.
Awesome. I would love that. Leah, seriously, I would love that.
I am totally into it.
Awesome.
Well, yeah. And I'd like to connect you with someone who runs a site called Bionic Health.
Cool.
The thing that I'm seeing lately is that there are a lot of people who are trying to start up sites that are about aggregating and selling all of the sensor-based medical devices that are out there, because there's a proliferation.
There is, yeah, starting.
Yeah, I was at the Launch Festival last week, and there was someone who has a shirt that is fully sensed, and that they're called Ohm Signal. They're actually worth looking up. They're just launching, but it can monitor your heart rate. It can evaluate your level of focus based on some interesting algorithms that they have, and it's an undershirt in which you see no sensors. But I was sitting here thinking, okay, there are lots of products like that. I wonder if they had to get FDA approval, and you should be like...
Absolutely. It would be so interesting to partner. Absolutely. That sounds really cool, and I haven't heard of them before, so I'd love to get connected.
Okay. So. Happy to do that.
Awesome.
Excellent. Thank you. See, South by is all about serendipity. Inder reached out to me and was like, hey, are you going to be in Austin? I'm like, well, yes, of course I am. And it led to something productive and good.
Absolutely. Leah, thanks for having me.
Of course.